My name is Dr. Benoit Desjardins. I'm professor of radiology and medicine at the University of Pennsylvania. I'm also a computer hacker, and I've been running the RSNA cybersecurity refresher course for the past few years. Cybercriminals try to hack every US medical center every day, and the number of successful cyber attacks is growing exponentially. Cybercrime will cost the world $7 trillion this year alone. Many cyber attacks result in data breaches exposing medical records. There have been over 4,000 healthcare data breaches so far, affecting almost all medical centers in the US. The data breach against the Anthem healthcare insurer in 2015 exposed 78 million medical records. Ransomware attacks have become the most common type of cyber attacks. A third of all US medical facilities reported ransomware attacks last year alone. The ransomware attack against the Scripps Medical Center last year disabled its computer systems for 1 month and cost over $100 million to recover. Small US medical clinics have been forced to permanently shut down due to ransomware attacks. Patients have even died from ransomware attacks. Cybercrime will continue to grow every year as long as money can be made from it. Several countries like Russia, North Korea, and China have armies of hackers committing cybercrime. These hackers are wicked smart, well-trained, extremely patient, and have nothing to lose. Their tools are becoming more precise, more sophisticated, and more automated, and take advantage of the latest developments in artificial intelligence and deep fakes. These tools make it more difficult to detect and defend against cyber attacks. Less sophisticated hacking tools are also sold on the dark web, increasing the pool of attackers. The National Security Agency, the highest concentration of hacking brain power in the United States, runs an annual hacking competition to identify the best hackers to defend the US against cyber attacks. They even tried to recruit me last month, when I was one of the handful of winners of this year's competition, involving thousands of hackers. Foreign cybercriminals keep attacking the United States with complete impunity because our government and justice system have chosen to punish the victims of cyber attacks instead of going after the criminals. This is like punishing victims of bank robberies instead of putting bank robbers in jail. After a cyber attack, US hospitals face years of regulatory inquiries and litigation, diverting limited resources away from patient care. This phenomenon is most extreme in the United States, making us the biggest target in the world for cyber criminals. Every medical center must defend itself to prevent daily cyber attacks from interrupting delivery of care or compromising patient safety. Many experts and tools are available for cyber defense, and medical centers need to make good use of these resources. I'd like to emphasize 3 important aspects of cybersecurity. First, cybersecurity is more than a local hospital problem. Protection is also needed for the supply chain. Malware attacks on third-party software such as RIS, PACS, or voice recognition software can affect many radiology departments across the country. Protection for remote radiology workers is also needed. The entry point of some of the largest cyber attacks against hospitals have been through remote workstations. Second, the entire medical workforce needs to be aware of cybersecurity. Phishing emails have become the most common entry point in cyber attacks. Medical centers must run phishing campaigns against their employees. Those who become victims of such phishing attacks should receive additional training on how to identify and avoid phishing emails. Third, we cannot prevent all cyber attacks. There are 300 million new lines of computer code written every day, introducing many new vulnerabilities. The exploitation of these vulnerabilities, also called zero-day exploits, cannot be prevented, but must be detected as early as possible to limit the damages. The WannaCry ransomware attack in 2017 involved such a zero-day exploit against Microsoft Windows. It took only 4 days to spread to over 200,000 computers in 150 countries and caused over $8 billion in damages. Be safe and thank you for listening.